Hi, I'm Taylor Truce, and I'm here to talk to you about preventative medicine and how to improve it. Imagine having a heart disease or diabetes when it could have all been prevented. Imagine going to the doctors and them having the knowledge of how to help you before your condition got worse. Imagine if doctors and administrators put a little more time and concentration on being healthy and training you on how to have a healthy lifestyle. Imagine if the government spent more money on projects to help raise awareness of a healthy lifestyle, preventative medicine, and training for physicians and administrators to effectively communicate how to live a healthy lifestyle and prevent diseases and avoidable illnesses. According to the Center for Disease Control and Prevention, 29.1 million people, or 9.3% of people, have diabetes. Also, according to the CDC, about 610,000 people die of heart disease in the United States every year. That's 1 in 4 deaths. A way to prevent diabetes or heart disease could have easily been prevented by making healthy choices and living a healthy lifestyle. Physicians get paid for how many patients they see and what type of treatments they provide instead of promoting a healthier lifestyle and informing on how to have a healthier lifestyle. A part of the reason that it is like this is because insurance companies control a lot of what goes on in the healthcare industry. According to True Cost of Healthcare, different insurance companies will pay doctors a different amount for the same billing code. Depending on the type of insurance you have or where you live, there are different payments and co-payments a patient has to pay or not pay. Along with patients and having to pay to see a doctor, treatments, surgeries, and prescriptions, there's a lot of money that is spent on healthcare every year, and where does it go? There is research out there that suggests some of the money that is spent is wasted. According to Medical Recovery Services, there are 6 wasteful practices in U.S. healthcare spending, including unnecessary services and procedures, inefficient care execution, administrative waste, inflated prices, poor prevention tactics, and abuse. Millions and billions of dollars are spent going into these practices and tactics, but some people are not seeing the results of them. Healthcare administration has a lot of money going into it, and there should be beneficial results coming from the amount of money being spent, but there isn't. Poor prevention tactics go hand in hand with too much money being spent on healthcare administrators because it is their job to train and facilitate doctors who will emphasize the importance of preventative care. Bottom line, the American people need to be more aware of how they can take care of their bodies and have more access to healthier foods and safe parks in their area. The issue with our healthcare system is not doctors and physicians being paid enough, but what they are being paid to do. They get paid for how many patients they see and how many tests they order, and that is something we need to stray away from. If doctors and physicians had an incentive or got paid just the same for better preventative care, then it would be fine. As of right now, that is not how our system works. Healthcare administrators need to find more ways to be able to implement training and awareness of preventative medicine along with an overall healthy lifestyle. In Maureen Malone's article, she states that along with duties as in managing cases in patient files, they are also a part of program developing. With their job being program developing, more programs need to be funded and implemented that emphasize healthier lifestyles and ways to prevent diabetes if that runs in the family, for example. There should be options out in this field where seminars can be held or informative meetings can be ran by doctors to help emphasize these, and the doctors also get paid decent money for doing it. Administrators and insurances need to implement a system where doctors get to spend a little more time with their patients in order to effectively figure out their issue and create ways to tackle or prevent their issue. More money can be spent in creating flyers and posters that remind regular patients how to have a healthy diet and exercise. Doctors need to be able to spend more time with their patients in order to educate them. Overall, the system fails the American people by not giving them all the necessary tools in order to live a healthy life. Everyone is aware that eating chicken and broccoli is good for you, and an hour of exercise a day is also good for you, but there is not enough emphasis on living this type of lifestyle to live a long, healthy life. Administrators need to be able to educate their physicians better on dealing with at-risk patients, and insurance companies need to promote preventative medicine rather than drugs and surgeries. Thank you.